All right, first thing I got to do for our social media team, I'm just going to do a little selfie here with everybody. You're welcome. You're welcome. Okay. All right, try and get everybody in there. Okay. All right. Good morning, Medlive team. Come on, let's hear it. Good morning, Medlive team. All right. I am thrilled. Come on in. I am thrilled to kick off 2025 here with all of you in this iconic stadium, Gillette Stadium, home of the New England Patriots, of course. Yes, a team that embodies that championship spirit, has a commitment to excellence, and lately also a determination to build and for the future, right? And as we all gather here in this place where legends are made, we all realize and we're reminded that greatness is not built overnight, right? It is built through relentless teamwork, innovation, and a commitment to be better every day. And obviously, all of us at Medlive, we share that winning mindset, that growth mindset, that Sherry often tries to instill in each of us. And I have no doubt that the work that we're going to do here over these next couple of days will continue to push us to transform medical education and improve outcomes for all of those who we serve. In 2024, we invested heavily in launching Medlive and our new conduit platform. We developed new products, new features, and as I look around the room, we also have a lot of new colleagues here who are with us for their very first Q kickoff. So welcome to all of you. And as we think and look forward to 2025, obviously we are here not just to play the game, but to win, right? And win for our partners. And we're going to hear from an amazing partner that we have here today. Our patients and caregivers, most importantly, and for each of us. So as we begin our planning for 2025 here these next couple of days, let's channel that championship spirit and energy into everything we do, and let's get started. So I will kick off with just outlining our objectives for the next couple of days, our goals, and kind of go through the agenda. All right, so meeting objectives. First and foremost, obviously you're going to hear, we're going to lay out our OKRs and goals for 2025. The leadership team, we're going to go through those in detail and obviously answer questions that you may have. But the idea and the spirit is that once we lay these out, all of us are going to bring that to each of our meetings in our departments and our groups and figure out how we roll into those OKRs and support our success in 2025. Want to improve our knowledge of our products and features. There's been a lot that's happened over these last 12 months, and the breakouts and the sessions that we have planned over these next 2 days are really to give each and every one of you a real feel for the different products, the different features, and the tools that we have. Haley and the marketing team are going to help us to understand how we can play a role in continuing to build the excitement and the brand that we launched in 2024 in terms of Medlive. And then obviously we're here as a team to get to know each other, improve collaboration across the teams, and ultimately be able to support each other and the goals that we have for this year. And obviously getting to know your colleagues and have some fun. All right, let's jump into agenda. Everybody's seen it, but we're going to start this morning. Catherine is going to lead a session with our partners at AAFA, and thank you to Kenny, CEO of AAFA, for being here. And it's going to be a great session. And then we'll review OKRs, and then we're going to get into the breakouts. First breakout of the day will follow. Haley is going to do a session on Medlive and the brand and how you could help to really share the voice of Medlive. And then we've got more breakouts. Those who want, yes, it's cold, but encourage those to take advantage. We have different groups and opportunities to go up to see the lighthouse. And then tonight we have the social at Splitsville. So, in terms of our group leaders, Jean is leading group 1, Jeff is leading group 2, Emma group 3, Alyssa group 4, and Hannah group 5. If you have questions in terms of which group you're in, come see Sherry or Kaylin or myself. Also, look on the back of your name tag. Your group number is there. We're going to regroup here at noon, and as everybody knows, our partner at NORD, Rare Disease Day, is February 28th every year, and we're going to gather here to take a picture in support of NORD and Rare Disease Day, so let's meet back here. One request, let's stay focused. Obviously, some breakouts are going to require your laptops and use of electronics, but the sessions that we're participating in, where we don't need a laptop, let's stay focused on the session and avoid any multitasking and distractions. So with that said, let me pass it over to Catherine to lead us and our friends at AAFA.
All right. Okay, sounds good? Yes. All right, so very excited. First of all, this morning we're going to spend some time and talk about our educational initiatives and our partnerships. But before we start into that, we want to thank everybody in this room for the work that we did last year on our educational initiatives. We are making a difference. Through our educational initiatives, we're showing significant change in behavioral changes and in clinical gaps. So I want you to all, I hope in the next couple of days, talk to each other and talk about what we're doing, because every single person has their hand in this. And what are we all trying to do? What's the mission here? To move the needle in healthcare. And we are doing that with the impactful education that we are showing. What we do matters. What we do is working. How do I know this? That's my little bleeding. Look at what they're saying. When we go back to our partners or our caregivers or our clinicians and find out what did they do after they participated in one of our educational initiatives, they are making change. When someone says to us, after this digital educational program, I took steps to begin the screening process for joining a clinical trial. Boom, impact, behavioral change, moving the needle in healthcare. When they say that they're sharing the information that you all created with our partners, with a friend, what are we doing? We're distributing our education, we're reaching more people, we're getting the mission across. When they say it's good to hear other people's perspectives, they're not alone anymore. They're downloading the resources as a tool. Think of how powerful that is. You're helping a mother with a sick child out there find resources, download them, and share them. You know, they finally, once another patient told us that they feel comfortable asking about different options and coming up with a plan together with their clinical team. That's the goal. How do we move the needle in healthcare? By empowering people with education and tools that matter. So kudos to everybody in this room. It's pretty exciting what we're doing. And the next couple of days, we hope that you all talk to each other and figure out other ways that we can show impact and change. So how do we get to these patients and caregivers? Well, it's through our partnerships. And look at this growing list of partners. For anybody new in the room, our partners are patient advocacy groups with the same mission as ours. They are medical societies for clinicians and professionals. And through our access with them, we can speak to key opinion leaders. We can speak to patients, caregivers. We can find out what the needs are in education and together create this. They have the same mission. How can we show change? And I can tell you firsthand, I ran the National Kidney Foundation before coming here, where I learned the power of empowering caregivers and patients and clinicians with the tools that they need to make that change. So if you look across at this is an incredible list of partnerships. And this is what we do. For instance, if we're doing a program in leukemia, who do we go to? Lymphoma and Leukemia Society. Speak to the experts, speak to the mothers, speak to the caregivers, find out what we should do, create the education that you all have a hand in to show significant change. And we take those outcomes, and we can show those outcomes to hospitals, to our supporters, to our patient partners, so we can create even more advocacy on the Hill, whatever we can use with our outcomes to change, make a powerful change in healthcare. That's what we're doing. So it's very, very exciting. So today, what we want to do is focus in on one of our favorite parties, AAFA. You might have heard that acronym. AAFA is the Asthma and Allergy Foundation of America. And we've been partnering with them for over 4 years now. They are the leading patient organization for people with asthma and allergies. What's their mission? AAFA is dedicated to saving lives and reducing the burden of disease for people with asthma and allergies through support, advocacy, education, and research. So this is a powerful partnership. Together, we've been doing incredible work for the last couple of years. If you look at the metrics, for the last 4 years, we've worked with, this is one of our partners, an incredible partner that we've done 52 educational sessions. This is meaningful. We've reached over 12,000 patients. This is the impact I'm talking about. 35,000 CME program attendees. We're reaching the physicians, the professionals who need to know what is happening in this space. Across 7 conditions, and we've created posters, publications, presentations. Again, the power of collaboration. We couldn't do it without our partners and their insights and their incredible, great ability to collaborate on everything we do. And this is something else we want to talk about in the next couple of days. How else can we work with our partners? How else can we get our education out there to make change? You know, some of the things we did with AAFA, it's not just our educational initiatives, which are all the modules and the programs that we all produce together, but we can write papers. We can do posters, and the posters go to all the conferences across America, so we can, again, exchange ideas, find out where the gaps are, create even more powerful education. We do social media campaigns. There's so many things we can do, and I hope that we can all engage in more conversation the next day on what else we can do with our incredible partners. So, without further ado, oh look, there's a picture of Stacy, our speaker, who got stuck in the snow. Okay, without further ado, I want to introduce Kenneth Mendez. Kenny is the CEO and the president of AAFA. We are delighted that he could join us today. A little bit about Kenny. He came to AAFA from ADVAMed, which is the world's largest medical technology association. His career has bridged the corporate and nonprofit sectors from Wall Street to the Walt Disney Organization. He was the past chair and the current member of the National Health Council. And at AAFA, he has established a multi-year strategic plan that emphasizes reducing the impact of asthma and allergies on the underserved and tripling the AAFA community. Great, great plan. We hope to be a part through all of our educational initiatives to really make a difference. So let's welcome Kenny, a family man, avid fisherman.
Great, thank you. Thank you, Catherine. That was, so I'm Plan B. Catherine mentioned that Stacy was supposed to be here, and some of you might know her because she's the star on a lot of your programs here, but she got snowed in New Orleans, and there were, I think they got 10 inches of snow in New Orleans. And so I was somewhat nearby for the long weekend in Rhode Island, and I was thinking, okay, snow in New Orleans, like, come on, give me a break. So at any rate, if we're using football analogies with Kickoff in 2025, I'm coming off the bench here to take over. But I really appreciate what you all do, and I first want to say thank you, and thank you, Rob, Dave. I mean, I remember when we first met when I was a new CEO at AAFA in 2018. And you're meeting all sorts of people, and you have to figure out who you're going to trust and who you're going to work with. And I remember we started with one program as a test, I think, in 2018, and now we're up to almost monthly programs with you, and it's been a core part of our business that is really important for our community. So I'm here representing the organization. Shreaya is here as one of our patient advocates also. But maybe I'll tell you a little bit about my story. Catherine described it here and how I worked on Wall Street, was working at Walt Disney early in my career, but I ended up in the nonprofit world because purpose was really important to me. And I get that sense from what our partnership is with you and what you're doing. And so I took everything I learned kind of in the for-profit world and at Disney and applied it to working for a nonprofit that is near and dear to my heart, which is Asthma and Allergies. There's a longer story about the fishing piece, which is how I ended up there, but we could talk about that at another time. So let me just show you a little bit of that. Is it the big green up here? Okay. So let me tell you why this is important and how it relates to me, because as my wife says, it's always about me. This is our youngest son, Theo. And by the time he was 2 years old, he was in the emergency room twice with anaphylaxis. He was on a severely restricted diet. He couldn't eat beef, dairy, peanuts, eggs, basically nothing out of a cow. And his diet was severely restricted. But when he was that age, you'll see in this picture the eczema around his face. And this is really important, a learning experience. I don't know, how many of you have allergies in the room? Okay, that's what I figured. There are a lot of people with allergies. But he had severe food allergies. But back when he was young, what they thought was that if you started to have eczema on your face, that meant you might have a food allergy. And then there's always this dynamic about, okay, once the pediatrician, so the general practitioner, someone who's not a specialist in allergies, saw the eczema, they would say, why don't you avoid those foods? So for a long time, there was this philosophy of avoiding foods. If you didn't know, there are other tests that you could take, but generally the first sign is if the baby had eczema, stop giving them the food that might have triggered that. And that was when he was young. He was born in 1997. That was the standard of care back then. And it's completely reversed since then. Because what the allergists have said now is if you have food allergies or a history of food allergies in your family, you should actually introduce some of those foods earlier. And a little bit at a time, but work with your doctor, let them know. But this is how things have completely changed. But what happened when Theo was young and what it created, because the Physicians Society just made this decision, and there are books that have been written about this, that it could have caused more people to have food allergies because they avoided it. So it actually made things worse. So this was Theo, and he was our youngest. But when you have a toddler or a child with food allergies, again, this is back when my kids were young. The middle son, Will, well, Theo's in the middle here, but Will is on the left of Theo. Will also has a peanut allergy and continues to have peanut allergies today. All of them had asthma and allergies. 2 of the 3 had asthma and allergies. So as a parent, when you leave, and this is true for any health conditions, which is why these partnerships are so important, is when you leave the doctor's office, it's a blur. You have no idea, you hear what the doctor says, but you get home and you have to then figure out, how do I put a meal on the table? What do I do? How do I deal with play dates? How do I deal with the school? It's a tremendous challenge. So that's what we do as the Asthma and Allergy Foundation of America. We try and provide that patient support. We try and educate our patients so they understand what questions to ask, how to put a meal on the table, how to deal with play dates. That was what our life was like when our kids were young. Now, luckily, Theo outgrew his allergies by the time he was 5. Sometimes that happens. They're lucky. But Will still has peanut allergies and asthma, and Theo has severe eczema now. I think they allow me to say this even though it's HIPAA, but they accuse me of making a living off of their allergies. This is them later now. This is why they can accuse me. And I look around the room and I see many of you are probably around the same age as my kids, but that's an example of how things have changed over time and why patient education and why what you do is so important. Because I now think about my kids, they're going to have allergies and asthma in their families, but now they're better educated in terms of what to do when they have a family, they have kids. So that's why it's really important. And the other thing that's really important, the most important thing is the caregiver in the family, who basically is my wife, Liz. That's a picture of her with Will. And love this picture because Will ran the New York City Marathon a couple of months ago. So if you have asthma and allergies, it shouldn't be able to hold you back. But having the confidence, having patient education, having supportive parents is something that's really critical here. So that's Liz, and some of who we speak to are caregiver moms. I mean, that's it. This day and age, I'm not sure whether you're allowed to say those things, but she was the primary caregiver. And basically, when we had kids with food allergies, we decided that she would stay home with the kids because that was really important to manage because there were all these risks involved. But we wanted to get our kids off to a good start and make sure that they were confident and could live their lives and not live in fear. And luckily she was around to do that and help them. And this was when I had my fishing job in the nonprofit world. So they were accusing me of going around fishing on all my business trips while she was at home taking care of the kids with severe asthma and allergies. Now, fast forward, I get paid to do this job and use them just as poster children to help advance the mission. But at any rate, I just wanted to say that that's why the work that we do together is so important. Whether it's in asthma and allergies, or whether it's in leukemia, whether it's in rare diseases, having patient advocates, having an educated patient who go in and meet with their doctor and understand what the right questions are to ask and know how to manage these chronic conditions at home saves lives. Over 10 people die each day from asthma, and it's really important to understand your triggers, understand what the right medications are. And the programs that you do and that partner with us have grown from 1 in 2018 to monthly now because we feel that it's really important for our community and for our mission getting out there as a nonprofit. So I just want to say, thank you to everything that you're doing. We've grown and there's a reason for that. And I think as the slide showed with all the other partner organizations, I promise you that this meeting will get much larger in another 5 years. I'm sure your staff will be bigger as you get involved in more patient organizations because it's very powerful. The software, the technology, everything that's behind the scenes that you do is really important. So for those of you who are new in the room to Medlive, when you go home and say, what do you do for a living? You help patients. You help educate patients for better health outcomes to save lives. So I just want to say thank you for that. Thank you, Rob. Thank you for having me. I'm going to turn it back over to Kathy.
Thank you. That's great. Again, what we do matters. So kudos to everybody in the room. Now, we are very lucky to have a community ambassador with us today. She comes to us from being an advocate at AAFA, a patient advocate, for a few years, and she wants to share her journey with all of us. So let's welcome Shreya to the stage here. But let me see, what happened on Monday night in Ohio? Did some team lose?
Yes.
So Ohio had a big win. So sorry, Dave. Let's see. All right. We're very happy. Please ask her any questions you like as she continues. But as soon as Shreya is done with her spiel, we're going to come back up here and open it up to the floor. If you have any questions about patient education or any of our partnerships, we're happy to answer them. So thank you.
There we go. So there's my family. So hi guys, my name is Shreya. I've been a patient advocate with AAFA for about 4 years now. And I'm so excited to have the opportunity to speak with you all and share my patient journey and why I think that online patient education is so critical for patients like me. So first starting off with my patient journey and how I got diagnosed with asthma and allergies. So I went through this process called atopic march. So let me walk you through it. So when I was a baby, I had eczema, and it was an inflammatory skin condition, lots of eczema. When I was 2, I was diagnosed with a laundry list of food allergies and environmental allergies. And then when I was 8, I was diagnosed with asthma. And these 2 chronic conditions, asthma and allergies, they served as a point of exclusion in my life. So for instance, my list of food allergies includes all nuts, peanuts, coconut, soy, lentils, most legumes, most seafood. And I'm South Asian, and that meant that I was excluded from eating a lot of key ingredients in South Asian foods. However, I'm so lucky. My grandmother, who's up there right now, she lives with my family at home, and she's amazing. She has made a lot of modifications to her traditional recipes so that she could accommodate for my food allergies and so that I could have a comfortable place at the dinner table and eat alongside my family and feel included. And then with my asthma, I live in Ohio, so we had a lot of harsh winters when I was growing up. And I had a lot of the common cold, I had the flu 3 times, and every Christmas, my family had a Christmas family reunion, as you can see on the top right, when I was little. And during these reunions, I can only remember 2 times when I didn't have the common cold or I didn't have the flu during when I was eating them. And what this meant was that my regular daily inhalers just weren't cutting it, and maybe my rescue inhaler wasn't either. So we went to the next level, and it was called a nebulizer treatment. And these treatments, although they're super helpful in treating and managing my symptoms when there are hard times, they're very noisy. So I'd kind of be put in an upstairs room by myself taking these treatments. And it's kind of very isolating when you're a little kid because you're upstairs taking a noisy treatment, you're feeling down, you're sick, you can't breathe well, and yet you hear your family having a really lively time downstairs. So you feel very alone. And through all this bad still, I have an amazing support system with my friends and with my family, with the real MVP, our most valuable player, being my mom. My mom is an internal medicine physician, and she has played such an important role in how I tackle these diagnoses head on each day. And she has grown my confidence and my independence too, as being an adult and managing these on my own now. She's educated me on what my conditions are. She's educated me on how these medications work, how I should use them properly, how to read food allergy labels, etc. She is amazing. And you realize the importance of this education and having her by my side. Because for instance, I played volleyball when I was in high school, and we had this drill called 2990s. So imagine a volleyball court, you got the shortest width, right? You had to run 29 lines in 90 seconds. It was awful. I don't miss it at all. And 3 of my teammates, they had sports-induced asthma. And one day we're doing this drill, running really hard, and one of my teammates had to go to the sidelines. She couldn't breathe well. We stopped the drill. My coach goes over, asks her, hey, like, can you find your inhaler? You seem to not be breathing very well. And it takes her some time to find her inhaler. By this time, she's very stressed. She's not breathing well at all. And this is her first time having an asthma attack using her rescue inhaler. My coach, he didn't know how to properly walk her through it. She was getting very stressed as well. And so I calmly stepped in and tried to calm her down. She's my friend. And kind of walk her through how to use that rescue inhaler too. And this makes you realize that, medication is very important to have at the right time, but so is patient education, because these are life and death circumstances for certain people. So it is critical to have that kind of education. And knowing all this, I really, really want to advocate for my own patient community, people with allergies and asthma. And so that's what led me to reach out to AAFA. And originally I just wanted to fundraise, maybe share my story for other people to see, but I kind of flourished as a community ambassador over these past 4 years. And I've had some amazing opportunities, including doing fly-ins on Capitol Hill, where I advocate for AAFA's legislative asks to my Ohio representatives. I've also done a type 2 inflammation webinar, again, the Atopic March, my patient journey. I've done an FDA patient panel where, as an asthma patient, I expressed my concerns about what I would like to see in future asthma treatments and how it can better serve us. And I've just simply shared my stories, hoping that on different blog posts, hoping that people can also relate and that parents maybe won't be as worried when they're sending their kids off to college and kind of know that you're not alone in this journey. And AAFA has given me a lot as well. For instance, they've provided me a community that I've been missing ever since being diagnosed at the ages of 2 and 8. I haven't really been around a lot of people that have been diagnosed with food allergies or asthma, but listening in on other advocates' stories, it makes you feel not as alone. And then I also got the chance to read a lot of AAFA's reports and their public reports, like the asthma and allergy capitals in the US. And through these reports and even advocating for legislation on Capitol Hill, I realized that there are so many health inequities within my patient community. That solidified my research interest. I got to pursue it last summer. So I'm very grateful for those professional opportunities too. And then lastly, and most importantly too, I have had a lot of educational resources at my fingertips by being with AAFA through their newsletters, through social media, and they have really educated me on what the new research is in the field, what new medications are coming out. And this is really, really important to me because as a patient, when I go to a doctor's office, I don't want it to be a one-way street where they're saying, these are your levels, this is your diagnosis, these are your treatment options, what do you want to do? No. I want it to be a two-way street where we're having an open discussion and I'm saying, hey, I saw this about my condition, should I implement this lifestyle choice? I saw this new medication being rolled out, is this an option for me? And I want to have an open discussion and forum with my doctor and my allergist about would this be beneficial for me, and I want to feel educated and empowered when I'm talking to them as well. So that's why online patient education is so important. And I also say online is very important as well because I am an advocate for health equity within my patient community, and having things be online makes things all the more accessible for a lot of different ranges of patient types. So I want to thank you guys for having such a big role in creating online patient education because it truly means so much to patients like me. Thank you.
Okay, we're gonna go to a Q&A, but I think one of the big things you talked about was your mom. It's the caregivers, and I think we have to remember that when we're designing our education and thinking about what the outcomes are. It's the caregivers that are really seeking out education for their family. I can't tell you how many people have called and talked to us. Things about guidelines. Each one of our therapeutic areas has specific guidelines, but they're written for professionals. Mothers have called me over the years saying, why can't you give this to us? Why can't we change it? And so we've taken the KDIGO guidelines, which is a renal group, and taking those and made them more friendly for the renal society. This is, we should be able to do that as we move on. Just to go back to your point, that it's the moms, usually the moms, I don't know why that is, but the caregiver who is seeking this information. I think that's a really big point. So why don't we bring Kenny back up here? We can sit over here. Here's another mic. And I wonder if anybody has any questions that we can answer in the next few minutes before we move to the next session that we can help. Great.
I'm there. How did you hear about it?
Go ahead. You go.
I looked up online about AAFA. I really wanted to be involved in something that handled asthma and allergies, and this was kind of at the forefront of it. And I really enjoyed that they had specialized programs for health equity, health equality, and that they had like state chapters and local programs that helped all of these communities on a local level as well as a national level of providing that education.
Yeah, I don't even know if everybody knows there are so many patient groups out there for all therapeutic areas. If anybody in your family is having an issue, you can reach out to all of these people. They are mission driven, they have resources, they can help, and it goes across therapeutic areas. And that's why we have our new Medlive pages too for all of our partners, so we can put that information up online. To Shreya's point before about the access of digital education. That's what we're doing, and that's what I was saying before about what we do matters. As long as we can use this digital education and get it out there to the right targeted audiences, we're making a difference.
You know, just to build on that, thank you, because you could have my job after this. From when I started in 2018, we were doing a new strategic plan, and we were doing the vision, mission, core values. We had a mission statement, but we didn't have a vision statement, so that kind of fell on the CEO. So that was my job. First CEO job, and as our board and I led that plan, the vision was to be the trusted ally on behalf of the asthma and allergy community. And it could have been, I wrestled with this. It was like solve world hunger, cure asthma. But I was thinking about our organization and what was important to our community, and it was really to be the trusted ally, to be the source of information. So that's actually in our vision statement. So when you think about where we are now as a society, we have become a trusted ally, whether it's advocacy work on the Hill or whether what we try and do in the community. So people come to us, they've heard of AAFA, and they trust what we say. So what's really important for us when we put out that information is to find a trusted partner and to make sure that the information that we send out there is solid information, is helpful for the patients, and we're perceived as an organization as the trusted ally. There are a lot of other organizations out there in the asthma and allergy space as well, but we feel we're unique, and some of that uniqueness comes from this partnership that we have with you and how we convey that message of trust through our educational materials.
Hi, I'm Johnny. What I'm hearing from both your stories, and thank you so much for sharing some personal anecdotes, is that there's so much power in meeting and having a connection with someone else, and having support and having an ally, as you said. I'm curious from both of your perspectives, as we continue growing a digital footprint, what does it look like to keep that at the core, to build community, to continue facilitating connection amongst people who are managing asthma, and how can we be impactful in that journey as well?
Yeah. So I've found that social media has been a big role and player in kind of keeping online communities together, because when these organizations, they send out newsletters, maybe at the forefront you will have an article title that catches your eye, but having those social media clips of allergists or patient advocates kind of share your story in real time, that catches your eye on social media immediately. Or people saying, hey, there's this new treatment, we have this article about it, and a post that catches your eye immediately. And then especially building on community, having that kind of online community and the comments, people saying, hey, this happened to me too. You can connect with people very, very quickly over that digital space as well. So I think social media has played a big part in maintaining those online communities and those relationships and make you feel like you're not alone in this.
Yeah, so that's a challenging one for me, given my age and demographics. I'm a boomer here. But again, going back to the theme of trusted ally, there's a lot of information that goes out there on social media that can be inaccurate or just plain wrong. And so it's who's giving that message and who's the trusted partner and trusted voice in it. So we're on social media quite a bit. We monitor it. We pick trusted allies. We have ambassadors. We have others who speak on our behalf, and we have partners like you, Medlive. And so hopefully the information that we put out there will send people a more in-depth course so they can understand and learn more about the conditions. I leave it to you, technically, as you innovate and come up with new products to help educate people and to make it engaging for them. I mean, for us, the number one challenge is to make sure that the information is understandable. So we have to speak to a 5th grade level. And actually, when I'm doing advocacy work on the Hill for Congress, it's probably like a third grade level or kindergarten. But seriously, keeping it simple, but making sure it's factual and correct is really important. That's our bread and butter.
Right, it's the trust, it's the integrity that nonprofits and your mission that brings through. And that's why patients will talk to you. And we've seen time and time again, a physician can tell a patient something, patient's not resonating. But when a patient tells a patient the same thing, we watch action happen. We watch behavioral change because patients feel they can trust another patient or they can trust a group like you guys. It's key.
Johnny, thanks for taking up my question. So I'm from the social media team. I was going to ask a similar question. So going off of your points, being trusted, being in a space that is really providing that authentic, real information. I guess my question for you both is, what kind of content do you feel like would resonate most with your audiences? Is it short form video? Is it long form? Is it snippets from our launch programs? We experiment with all of the above, but I would love to hear more of your perspectives.
Yeah. I think the ones that resonate with me the most are the videos with either patient stories and how this journey has impacted them, what's worked for them, how they manage these symptoms, or how they teach their kids how to manage them as well. And I think the other form of videos that really resonate with me are Q&As with allergists. Some of these allergists I've known or have known for a while. And so it's nice kind of seeing them maybe debunk some myths or not spread misinformation. And I'm like, oh wait, I didn't know that was happening. So it's nice to see that from another doctor's perspective as well. And then by having a Q&A with them, I have another trusted source, the allergist, that's probably on social media too, that I can go to find information from as well. So I think that's important as well.
Yeah, I think the short form is good. We're also experimenting ourselves with podcasts, so going quickly on that. But just to build on the clinician side, and this is really an opportunity, I think, is that educating clinicians. We talked about underserved community. I just got off a board meeting last night. We were doing some strategic planning again. But one of the allergists talked about our focus on underserved communities, and what he brought up was underdiagnosed and poor medical care. And so as we think about our next 3 years in terms of our strategic plan, I think having more of a presence within the clinical field and driving, better treatment, better diagnoses will be really important. And I think that's why programs like yours will be really important for clinicians. So when we send people to clinicians, that the clinicians know how to diagnose, know how to have a conversation with the patients. That's really important.
Seth, go ahead.
Just a quick question. Are there any best practices you've seen on behalf of the pharma industry in terms of putting forth very good objective information? It may be above brand, but somewhat loosely tied to a specific therapeutic area of investment.
I think with biologics kind of rolling out for asthma and allergy, I've done a lot of research on what treatments would probably work best for me. So when I go on their website, the most important thing I've seen are testimonials and having that patient voice again say, this is how much it worked for me. And also kind of seeing what indicative factors that you might have in your condition, like if you're taking triple therapies for your condition or this, or it's moderate to severe, this is what's going to help you the best, and then this biologic is going to help you the best for this condition. Being very, I like the layman's terms and websites, it's very patient focused, and I like patient perspective stories on how it helped, and them just being very open about it, not having too much stats covering up how it actually makes people feel and how it improves their lives.
I'm going to go sideways on that question on the drug companies, because one of the things that we hear about, the most important challenge, is access to care and access to medications and cost of medications. So I'm just going to spend a minute on that, just to talk about that, since we get funding from pharma, but something that we've been leaning into very hard, especially on our advocacy front, is the cost of medications. And so you can have all this great education about certain medications, but then you go to the insurance company and they don't pay for it, or you can't access it, or your doctor gets frustrated because they prescribe it, but then it's not available. And that's a real challenge. And people are always frustrated because they don't know how to navigate the healthcare system and the insurance system. From an advocacy point of view, we're trying to shine a light on all the other aspects of drug pricing that's an issue. There are middlemen, pharmacy benefit managers, insurance companies, where patients basically get screwed in the middle. I mean, all these people are in it to help patients, but in the end, if patient can't afford the medication, but they have this great education, say, I want this, but they can't get it, then that's a real challenge. So I think doctors are frustrated by that system. Patients are frustrated because they don't know how to navigate it. So it's complicated. And we were just on a call with the CDC, and they've got these state-based asthma control programs. And last year, some of the pharma companies offered a $35 cap on inhalers. So they voluntarily said no one's going to have to pay more than $35 for their, and that was AZ, BI, and GSK. Those are the three companies. GSK launched on January 1st, and then the other two launched during the summer. But what we're hearing from the communities are that, well, we go into the pharmacy, we don't know how to get this $35 price cap, we don't know how to navigate it. And then we're hearing some pharmacies are saying, well, we don't carry that anymore because it's too costly for them to carry it with a $35 price cap. So those are the kinds of advocacy issues that we're dealing with, but it's a complicated system, and educating patients on how to navigate that could be an opportunity. I don't know, but it is challenging, and it also relates to the clinicians too, because they're prescribing stuff, they know it's good, the treatment works, but then they don't know how to get it paid for and covered.
Hi, my name's Amy. I'm an associate medical director here at Medlive. I just started here a couple months ago, so really excited to be here. This may be a little more directed towards Kenny, but when we're designing education, I think especially patient-facing education, having the role of the patient in the education, but also representatives of organizations such as AAFA's, it's so important. But also, I think having clinicians, healthcare providers that are real allies to patient education, which isn't always as easy to find. So I was just wondering, from your experience, having clinicians involved at AAFA or your network, your advisory board, having, healthcare providers that are really driven by your mission and how they've helped to grow that.
Yeah, sure. I mean, we have a medical scientific council, so we have an advisory board, and some of our board members are clinicians. And actually, you intern with one of them, and so you know them. But that is really important. So they are affiliated with AAFA because they believe in our mission. They believe in shared decision making, and that's really important. Not all doctors are like that. So that's why when we talk about the underserved, we're also talking about the underdiagnosed, because certain doctors might not have the perspective. And no offense to any doctors in the room, but some might have a certain way, not be open to things. And I think that's why it's really important to have a patient education platform where you go in as a patient, you can really push someone and ask questions. I was in the Congressional Black Caucus Foundation had a meeting, something like this, but it was on allergies. And so it was underserved community focused. This was in Washington, D.C. The room was basically all African American. They were asking questions, a really engaging discussion, but someone in the back of the room raised her hand, and she said, when I go to the doctor's office and I talk about my asthma and allergies, the doctor seems to think that I'm just trying to get on disability. And that was heartbreaking for me to hear from someone in the audience, because when you want them to have really good care, you want them to go to the doctor, we're telling people go see your specialist, that's a real challenge. So I think to your point, it's out there, it disproportionately impacts certain communities, but it also, there are bad doctors out there, and that's why it's really important to go in there with the right kind of education, so you can ask the right kind of questions and advocate for yourself.
Right, and Amy, I think it's a really important question because that's another value of our partnerships across our therapeutic areas. Each one of our partners have a board of doctors, have KOLs that are associated with the mission, with the advocacy group or the society for that reason, because they are here to make change. So we can leverage and speak to those doctors who are more willing to do a tethered with us, to do a program for clinicians and patients, that they're on board with that. Because, years ago, doctors weren't speaking to patients. It's been a big change and they're coming on board, but just another value of collaborating with our advocacy groups and the doctors that believe in the mission and will work with us to create our education.
I mean, you guys have brought us a tremendous platform. I mean, we have the doctors, we know what we want to do, but sometimes you need to get it out there. And Medlive really provides that. That's why I'm here, that's why we made a commitment to you all. And it's a really important vehicle for us and a tool for us.
Okay, Sherry.
You both shared, and anyone who has kids with allergies or friends with kids with allergies, places like the school lunchroom, art classes that are can be a nightmare. Have you been able to form any relationships directly with schools or coaches so that some of that education is not just on the parents?
Yeah, so we're trying to do that with the schools directly. I think the question was, have we been able to form relationships with schools or try and make it so it's not just the parent that's doing that? And that's what we try and do through our some of the materials that we have on our website. We make sure that people understand that there's something called a 504 plan. I mean, allergies is a disability, so you need to do that. But we just released last week our state honor roll report. So this is an example of the kind of publications we put out. And we rank all 50 states for grades K through 12 who have the best policies for people with kids with asthma and allergies. So that's another way of getting our voice out there. We have policy recommendations. Only 2 states made the honor roll this time around. It was Connecticut, and I should know the other state, but I think Connecticut was one of them. So we are trying to get the message out there and work with educators in order to try and improve care in the classroom and understanding the classroom.
My daughter actually was diagnosed with asthma. She's 9 months old. And switching from some of our healthcare providers to being a caregiver is overwhelming the amount of information that's out there. What do you recommend for caregivers or patients to get started?
Yeah, sure. As a patient, I did have an amazing mom who was a physician that did help me through a lot of the education. But as I grew older and I wanted to be more independent, I'm going from high school to college now. I want to be more independent in how I take these diagnoses. I want to know how scientifically these conditions are going on in my body as well. So I just kind of looked up different organizations that dealt with these conditions, and that's where I went from there. And from making these connections with AAFA too, I found other organizations that they trust, so I know that if they trust them, I can trust them. And from there, I found more people that I connect with in my patient community, asking them questions. I found more about their research, about what they're doing and how these conditions are present in our body, what medications are coming out too. So I think initially finding out that one organization you trust and then branching off from their partners or their trusted partners too, makes all the difference in finding more people to trust as well.
Yeah, so we have, again, what we hope for is that people come to our website, and actually we have an area that's password protected, but it's completely free. You register for it, and it's monitored by our staff, and we answer questions. We've got an Ask the Allergist area, but you can actually log in there, start a discussion with others. This is long before Facebook, but this is what we do and we moderate it. So our hope is that people will land there and ask those questions and branch out and find other patient experiences and other ways to care for folks. But we've got a very strong relationship with groups that do FPIs, and we do some of that stuff as well. One of our staff members, I heard your story saying, I'm thinking of Elisa. I mean, her kid had FPIs and is navigating that. So we monitor that, and we've got staff who can help facilitate answering questions and try to get you better up to speed as a caregiver. So if you go to our website, afa.org/join, it's completely free. We ask questions there just as you enter there, and then you get post questions to the group, and our staff monitors it.
Yeah, and there's lots of community groups, local community groups all over the country. And if you seek them out and find out another young mother with the same issue, that community really, really is strong. They contact us, they want education, and once you become a part of those patient communities, I think then you start getting, where to go, who to ask, what kind of education will resonate the most. Oh, no question.
The question was, how did we end up trusting you? Rob and Dave? Well, I think, it started back in 2018. That was first we had meetings, and you had an interesting platform and a vision for the organization and what you wanted to do. So trust is about developing relationships initially, just for me, and then it's about results going forward. And I think as Catherine showed the results of what we have seen, it was really important to us to continue to build this. So work with you as you've come up with your strengths, innovation in your platform, your technology. We have no expertise in that. But as we saw the benefit of the programs, the attendance, and what it's done for our community, that's how we established that trust. So it happened over time. We started with one test meeting, kind of on a wing and a prayer, and just talking to Rob and Dave, and then we built on that since then. And I know, like, I'm on the board of the National Health Council, which is the nonprofit for other patient groups, and one of my colleagues on the board there, you're working with now, and I gotta think that more of those organizations will come into the fold with you. That's why I think in a few years this meeting will be double in size, given your staff, your growth.
Yeah, there's always more partners to talk to. And one of the reasons it works, you guys, is because a lot of the nonprofit advocacy groups are working really, really hard with very few resources. Really, they have 2-3 people on staff. The money that comes in should rightfully go to research, not necessarily to build a tech platform or to even create the educational modules. So it's a win-win down the road. And that trust that you're talking about is really important because we can offer things to them and they're offering their expertise to us. So together we can make that change. Another question, Lisa? Oh, yeah.
Hi, I'm on the partnerships team here at Medlive, so appreciate you both being here. Curious to hear from you both, the patient voice has become a standard element in all of our education. So candidly, what do you wish more doctors understood about the patient journey and the patient experience?
I think what I would hope that more doctors would understand was maybe the home struggle of having these conditions and maybe educating, you have education about how to take your medication, how to take it daily, things like that, and how to do it in emergency situations. But I would want to see more education about lifestyle conditions and lifestyle choices, and probably more empowerment, like even though you're diagnosed with asthma, but even if it's sports induced, you can still do these sports, just be wary, and kind of empowering in your lifestyle, and then other things that would make your home life better, like maybe changing out these sheets every so often if you're allergic to mold, and things like that are very helpful. And I found I've had to go to online resources to find more of that education, and I wish doctors gave more of those lifestyle education choices in person.
Yeah, again, I just build on that. I think what our patients want is they want to be heard by their doctors, by their clinicians. So when they go in and meet with the doctor, and doctors are so pressured in terms of time and churning patients through and all the pressures on themselves, that could be a real challenge. But I think if you go into your doctor's office, I think you want to be heard. You want to make sure that they empathize and understand with what you're going through in the home front and what that might be like. And I think that I don't know how you could get that across, but I think that more doctors and more doctors that are up and coming would understand that. I think that would go a long way towards health equity, no matter what your demographics are.
Okay, great. I think we heard a lot here today. I think that we're hearing you about more quality of life in our education, maybe more about reimbursement and insurance and how they can navigate their journey that way. They're looking for information there. So we've learned a lot. We're gonna wrap up a little early. We did good, Team B.
Thank you.
At the last minute. All right, so anything else? All right, thanks you guys. Thanks for listening.